Hi, my name is Megan, and I am going to talk about challenges with the implementation of electronic health records. So here we go. For some background, electronic health records, or EHRs, have been credited with reducing medical errors, providing more effective communication, making sharing information easier at making sharing information easier, lowering costs, improving care coordination throughout the healthcare system. However, there are some challenges with EHR implementation. Some studies have been unable to show a direct correlation between EHR implementation and quality improvement, while others have been inconclusive. Without a direct positive correlation, the financial burden to implement an EHR can be too much for some systems. So, until the federal government stepped in with incentives, financial incentives, adoption rates were rather slow. That pace has picked up since the HITECH Act of 2010 was enacted. Much of this is as a result of fee-for-service reimbursement, and much of it has come into light in the public since the reports that healthcare has been unsafe, untimely, and undercoordinated. So since the high-tech initiatives, EHR implementation has increased, um, but there are some drawbacks. So purchasing, implementing, training, and maintaining an EHR is costly, and it's not possible for all for all health systems, to have access to resources to effectively implement an EHR. So one of the challenges, very specifically, is something called interoperability. Um, For electronic health records to be effective, they must be complete, correct, they must be in agreement with other parts of the medical record, they must be plausible, and they certainly must be current. Additionally, these records must be accessible to all healthcare or potential healthcare stakeholders for any given patient. In some institutions, however, an EHR is made up of several distinct software applications. Those applications have varying degrees of communication and data exchange with one another. In healthcare systems with this type of health information technology, care can be affected, as the pharmacist might need accurate, current, and complete lab work to know if a patient's medication is appropriate. Without that information, without that interoperability, patients can and have suffered. Care in the absence of EHR interoperability can be unsafe. So, not all software companies or EHR platforms offer complete and interoperable solutions. Many institutions have multiple systems that handle complex data such as radiology, lab, and pharmacy portions. However, the presence of these systems in silos does not offer coordinated care. Administrators, physicians, and other stakeholders should be aware of the risks and work to mitigate them. As you can see in Figure 1, the graph that's displayed, these rates confirm that in the presence of inadequate interoperability, patient safety events occur. Even though some of these events do not reach the patient, the environment is such that an error could reach and even harm patients. With the goal of making patient care safer, EHRs must be able to communicate and exchange information across different systems and platforms. So, information technology departments must understand the needs of the healthcare system and work towards interoperability of all systems. Additionally, staff must be trained to spot interoperability issues within their healthcare organization. Standard work among all staff can limit variability and increase the safe use of health information technology. For example, one emergency department found that EHRs were associated with an overall reduction in admission rate. This is likely because up-to-date health information is available and clinical decisions can be made accurately in a timely manner rather than waiting for records to show up from other departments. Therefore, health information technology is an expensive endeavor, but it is one capable of great rewards, so it should be undertaken by all health systems and then adequately maintained and updated. Finally, electronic health records are costly. There are challenges that remain, but high-tech policy has improved adoption, and policy should continue to increase access to these sorts of systems across the healthcare system. So, patients, hospital administrators, physicians, and the public must continue to demand quality care that results from coordinated HIT. Without interoperable systems, coordinated care is less likely as the timely exchange of information results in gaps that cause patient safety issues. While initially expensive, robust health information technology can improve care while lowering costs.